So the first thing are the intercostal veins, and they're little veins. It'll come off somewhere around this area, and it's usually really small and gets destroyed. So the next one on the list is internal thoracic or mammary, and that's this one. And you can see it comes all the way down to the bottom of the rib cage and innervates up here. Your vertebral is also usually really small and comes down posterior, which is it that one? Could be that one. Nope, there it is. Here's your vertebral. So if I fold that back over, it's covered up.
Oh, I thought you wanted to actually. So I didn't.
Next one is the brachiocephalic. So that's going to be these two first branches. The next one is your external jugulars. That's just these two big ones that go across the neck. Next you have your transverse scapular. And so that generally comes off of the jugular. So it's this one over here, and it kind of goes across the scapula. It's covered up by muscle right now, but it goes this way. You have your anterior and posterior facial veins, which come up here on the face. You got your anterior that comes this way, and your posterior that goes this way towards the ear. Your cephalic, which if you turn the cat's shoulder over, it's a superficial vein that goes across the shoulder of the cat. Your internal jugulars generally don't have to worry about because they don't get injected. So you have your external jugulars, then your internals are just going to be deeper down here. Then you have your subclavian, which is going to come off right here and go down under the scapula there. And your axillary is going to come off right around there too. And subscapular, so there's this big group of veins right here. So we got your axillary, which is usually kind of this little short section here, subclavian, subscapular. And the next it goes to the brachial, which runs along bicep, and that'll turn into the radial and ulnar, which if you go past down here, there's two little forks, and your radial is going to be the bigger one. It usually goes lateral, and your ulnar is going to be a really small one, and that one will run medial to the cat. So you're going to be down in here. And we got the posterior vena cava, which portal system is going to be over there on the other cat. The next ones down are your adrenolumbars, which you have your renal here first. Then off the renal is this one here that goes up to the top of the kidneys to the adrenal glands. The next one is the genital, which on this cat, it actually connects to the renal vein. That's going to be here. It's not very well injected, but this will run all the way down to the genitals. Your iliolumbars are the next ones down. You're going to run laterally. Then you have your common iliac, which is going to be, it'll fork right here, and here's your common iliac. And then you have your internal, which if I move this over here, if you can get in there, there's this vein that branches down right here and goes deep. That's your internal iliac. And then this one that runs along towards the groin is your external iliac. And then you have your femoral here, which branches to your deep femoral that goes towards the hamstring muscles. And then that turns into the greater saphenous, which runs along here and goes all the way down towards the foot.